I'm tired of being sick. I'm sick of dialysis, this, dialysis, that. The children are getting on my nerves. Bills, 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 bills. I don't know what else to do. I need a mental break. I need some help. I need something. I just don't know what else to do. I need an answer. I need something. Ugh. Mental, mental, mental. I need something. Ugh, what to do? This is the Lisa Baxter Show, giving you the 411 in the kidney world. Welcome to the Lisa Baxter Show today, and I am so glad you showed up and you showing out and you're coming on in. I went to church today, and today the bishop was talking about, Archbishop Rochford was talking about getting out of the cave. He was dealing with mental health and mental issues. Who knew the people in the Bible needed help and had mental issues? But God sure enough delivered, like he always do. You know that, and I know that. So just get whatever you have to get to help yourself with your mental issues, whatever it is, whatever you're dealing with. Maybe you need a vacation. Maybe you need somebody to talk to. Maybe you need to go for a walk to breathe. Send the children somewhere for a minute. Whatever it is, just go out and get it before any hurt, harm, or danger come to yourself or anybody else around you. You never know how far things could go. So this is just a love educational warning. So thank you once again and welcome. Today on the Lisa Baxter Show, I have a fantastic, fantabulous guest. Let me just read a little something about her. Her name is Tammeisha Smith. She's the Chief Executive Officer of Dunbar Center Incorporated, a community health and wellness facility, a dialysis center. A sister owning this thing, a sister building things up. I ain't mad at you. Welcome, Tammeisha. Welcome to the Lisa Baxter Show.
Thank you, sister. I appreciate you having me on your show.
What? We've been talking for a minute. We've been talking for a minute, but we never actually met. We've been texting, talking on the phone, doing the Facebook thing. So I am glad to have you too. I am proud about what you're doing. I follow what you do. And I am just very proud of you. And we're going to take our time and we're going to break it down and let the people know exactly what you do, why you do it, and what you're doing all together. Okay?
Okay. All right.
All right. So first of all, we're going to start out with your title or your title. What is Chief Executive Officer?
Okay. So the Dunbar Center facility that I'm building. So as a entrepreneur, taking a look at the services and the needs of the community. Mm-hmm. One, this is a medical facility that's needed. So I'm the owner and the chief executive officer of this brand new medical facility that's going to be built in the South Ward of Newark, New Jersey.
Wow. Wow. Oh, man, my hat's off to you. Let me give you a little hand there. I don't know too many dialysis center owners or anybody that would get something built from the ground, or I'm sure you're doing this so you could critique it the way you want it or the way the people need to have it, you know, the kind of help that people would need. Because I remember you asked me that one time, when I was on dialysis, what would I need the center to look like, or what would I need it to be? And that's a good thing that you would ask a dialysis patient that.
Yes, because there's so many facilities you spend so much of your time as a patient at the center or at the clinic, and you want it to feel welcoming. You're already dealing with a lot. So you want it to feel welcoming. You want it to feel inviting. You want it to be comfortable, because you're spending 3 days a week, 4 hours a day, a lot of your time at a dialysis facility or a health facility. And I want it to be warm. I want it to be inviting. So I ask dialysis patients, my brother included, as you know, has been on dialysis for almost 10 years. So I asked my brother, what would you want it to feel like? What do you want it to look like? How would it make you feel better, feel invited to go there? Because I know it's challenging for you on a week, a daily and weekly basis. So if this is a place that you got to spend a lot of your time, you
Yes.
want it to feel warm. You want it to feel inviting. And we want to make sure that you want to continue to come back for your care. So I ask the dialysis community, what do you want to see in a facility? And that's what I go with. I can only go, you get the best information from the people who experience it.
I'm not mad at you. You ain't never lied, honey. You ain't never lied. That's right. You really do. And that's a good thing that you did that, and I'm glad that you did it. Now, how long would it take for them to build it, or how long, or how what's
Yep.
what's going on with the project? Which I'd say.
So I can flip the screen and I'll show you the architect's rendition of what it's going to look like. It has an overlay. I have a picture. It's an overlay right in the south ward of Newark, where it's going to be on Bergen Street in West Runyon. So I'll show you the architect's rendition, and then I'll flip the screen back around.
Okay. Be my guest.
Okay, can you see that?
Yes, I can. Yes, I can.
So we don't want it to look like an institution. We want it to be inviting. And so this is the architect rendition. And yep. And so what we want to, it's going to be, we're breaking ground this fall. So in the third to fourth quarter of this year of 2019, it's going to take approximately 16 to 18 months to build from it's going to be approximately a 50,000 square foot medical facility, with the dialysis facility being about 25,000 square feet. So it's going to be the anchor tenant in this building is going to be 24/7, 365 for the dialysis facility. So unlike most facilities where you go and they, first shift is at 5:30. Still have the ability and the strength to work, to be able to come after work and then still to get their treatment and still be able to go home. People to come on the weekend. So we want to accommodate, at least 5 shifts a day. And again, so it's going to be 24/7, 365. And then we'll have a host of other specialists in the.
Well, you definitely need specialists.
Prime.
Okay.
Yes, this cardiologist, because we know that 70% of new cases of dialysis patients come from high blood pressure and diabetes in our urban communities. So we'll have those specialists in the building, primary and urgent care, cardiologists, vascular access surgeons, to make sure that people on dialysis, their fistulas are clean and working properly. So podiatrists, because of diabetes. So we're going to be a full service community.
Wow. Now that's what you need. You need everything there, because a lot of times it's a lot of work just to get to the center. And then you have to go to, appointment after appointment after appointment. This one, that one, this one, that. And you're so tired after that. Use up all your little money, your little car fare. You're mad now. So, but to have a lot of the stuff in the same building is a blessing and a help.
Yeah.
It's a blessing.
And you're absolutely correct. You're absolutely correct. A lot of times when a person goes serve and then they have to be referred or replaced, half the time they don't make it. You said they have life. They got to pick up kids. They have other family members. They have so much to do, so much running around, that they never make it to the other specialist treatments. So by putting them all in one location and making it easy for them to access care, we're hoping to improve the outcomes of them being able to get the additional specialty care that they need.
Yeah, because sometimes when you don't go to the other things, it can cause another illness that you didn't even have. You got an extra one now. God knows you don't need the extra one. Dialysis is something else by itself. So, you can't afford anything else to be wrong with you. I mean, this stuff is doable.
Right.
You can do it, but if you can dodge a bullet or get things easier for you, let's make the life easier. So with this facility, I could see it's being a help to to your community out there, in New Jersey, and that, section of Jersey at that, you know what I mean? So So I'm sure the community is more welcoming to that kind of thing instead of, God forbid, a prison or something going up. They get upset about shelters and prisons sometimes. So this is something
Right.
different that's coming into the neighborhood.
Well,
Wow.
I'm
Wow.
really excited about it. Not only is it bringing a medical facility that's needed because it's equal distance in between. You have St. Michael's Medical Center and University Hospital, which is a trauma center, at one end of
Mm-hmm.
Bergen Street in the Central Ward, and then in the South Ward you have Beth Israel Medical Center. So again, by providing this facility, it's providing medical
Wow.
primary care service and urgent care. So that keeps people out of the emergency rooms. Then the four
Yes.
dialysis
Amen.
centers, yes, the four dialysis centers in the city of Newark right now are already filled to capacity. So bringing a
Wow.
brand new facility with 30 stations, 30
Mm-hmm.
stations, five, we can manage up to 150 patients per day. So there are more than 1,100 patients leaving the city of Newark right now seeking dialysis treatment. And even at maximum capacity, we can only treat 308. I mean, that's just a drop in the bucket, but it's
Come on.
still going to be so much more convenient for so many people to be able to stay closer to home and get treatment. And again, 24/7. So it's going to be very convenient for people to come to.
Well, you also said it's full to capacity. So that can be trouble for some people because I know usually if you don't have a center, you have to be dialyzed at a hospital. And then sometimes you're
Right.
not even happy at your center. So if a new center is coming, you're looking forward
Yes.
to leaving and going somewhere fresh and new and start over, per se. You know?
Yes, yes, absolutely. So I'm really excited about it. One of the other things is the services that are be coming to the community because of the size with all the specialists as well as the dialysis facility. We're talking about 150 new jobs coming to the community as well. So not only addition to
Yes.
medical treatment and services, but we also economic stimulus by being able to provide approximately 150 new jobs, good paying jobs to the community.
Employment.
Yes.
Mm-hmm. And very well trained, I should add. They're
Yes,
they're
yes, yes.
specialists in their field. Because sometimes you get those 5 minute people. Now I ain't saying you got them, but some places get those 5 minute people who don't know their job or know what they're doing. So it's good to get somebody seasoned. You know what I mean? Or
Yes.
somebody that knows what they're doing, at least trained. So because things do happen. But now this is close to your heart doing this center, like you mentioned your brother. I want you to give some little background and love about why you went all the way out of your way to build a center from the ground, not just for us, but because this is near and dear to your heart. Talk about
Yeah. Yes. My brother is 44 years old and he's been on dialysis 9 years.
Okay.
So you're talking about a young man at 35 years old going on dialysis. Educate
Yeah.
myself about dialysis. Can you hear me?
Yeah, I
Okay.
can hear
I
you.
wanted
It's
to
good.
educate myself about dialysis, but just so I could understand the challenges he was going through
Yes.
and be able to listen intelligently at the concerns and the issues that he had. And the more research I started doing about dialysis and renal failure
Mm.
and chronic kidney disease, I
Ooh, you
started
did your digging.
realizing that this is an epidemic in the urban communities.
Oh, say
And
that.
so I wanted to, in our urban communities, our black men, um, our seniors are still the largest population on dialysis, but our black men, our young black men, 30 to 45, are the fastest growing population going
Ooh,
on dialysis.
my God.
So I just really wanted to educate myself to be able to understand the challenges that my brother was going through. But when I realized that this is really an epidemic in our urban
Mhm.
communities,
Yeah.
I just felt the need to do something more than just to be, a sounding board for my brother. I wanted to be able to
Yes.
do something more, give him something to look forward to
Hmm.
be involved and be engaged and be able to educate other people dealing with the same issue And
Yes.
so that he found some purpose in his life, that don't take to this disease, but be able to educate, be able to tell people your experiences, because we're not measuring success by the number of patients we put in chairs. We're measuring
Amen.
success by the number of people that we prevent from having to come to a dialysis chair.
What? You could say that again. I ain't mad at you. That's right. That's right. Prevention and education is the key.
Yes.
But it's heartbreaking that a lot of people don't listen. A lot of people want to listen after it's too late or they're already in the chair. It don't mean you can't love me, you can't help me, but it would have been nice to have helped you before you got in the chair.
Right.
Prevent you from getting
Yes.
in that chair, because that chair is a serious seat to sit in. So if you
Yes.
don't want to get in there, I would, listen, educate. So
Yep.
yeah, so your brother dealt with this thing, and talk about that.
He's still dealing with it now. He's on 3 different transplant lists.
Oh, okay, at least he's on one. Three.
It's
Excellent.
it's um people can become organ donors. A lot of people don't. You can do it when you register your driver's license, renew your driver's license. A lot of people don't. So organ donation is down, not just in urban communities around the country, and
Yes.
there's even less in urban communities. So he's on a transplant. He's on 3 different transplant lists, but he still has to go to dialysis, 3 times a week. And he's been on transplant lists for 7 years, and he's
Wow.
hoping to get a call. But at the end of the day, it's not that easy, because organ donations are down.
Yeah, they are. They're down.
Yes.
Because I'm even a donor myself, and if something happened to me, I'm a donor, because they don't want the rest of this. But whatever it is, that's good. But anyway, listen, there's a show called uh, Quest, Warriors Quest. All right,
Okay.
Jared, my good friend Jared, he's one of the producers on here. He's a host on this Urban Network with us, because it's like 8 or 9
Okay.
shows on here deal with different kidney stuff. So it will be good for you guys to try to contact him. I'll tell him about your brother as well. And they interview different people and put their information up, and people have been calling
Wonderful.
for the transplant and what have you. So
Great.
people don't
That
know
would be
everything.
fantastic.
People are afraid, people don't understand, and people don't know. And operations are serious. Cut me open
Yes.
thing, take one of my things out. And some people get nervous about that. Sometimes it takes a education or some love, because I would give anybody in my family an organ. I don't
Right.
have to be dead to do it. You know what I mean?
Right.
But sometimes it doesn't mean you wouldn't be fearful, but I'll just pray and I would do it if it'll help their life or save their life. So sometimes it depends what the person feel or what they know. But
Right.
I know how much you love your brother and how much you care about your brother. And we've talked a lot about him and everything like that. And I know you have a heart for men to listen, because you said that range group don't listen. It was a problem with insurance, and a problem with a
Yes.
lot of other stuff too.
Yeah, so my brother was disposed to high blood pressure and hypertension from, my dad and my grandmother. And as I mentioned, my brother went on dialysis at 35, so we're talking 9 years ago. It's
Yes.
only just recently, in the last 7 years, where the federal government said you can cover your children up to age 26. Well,
Right.
at the time that we're talking about, in the late 90s, when my brother turned 18 in 92, and suffered, several significant nosebleeds and had to go to the emergency room. So you're
Yes.
talking about, 94, he's 20, 96, he's 22.
Yes.
Um, he had no health insurance. You are no longer eligible to be on my parents', health care plan.
You
So
said
he
it
has
right.
no health insurance. And even though you go to the emergency room and, they give you medication, a prescription, well,
You
if you're
need money.
not, if you don't work a full-time job, or you're actively working, if you're
Yeah.
unemployed, you have you're 20, 22 years old, how are you going to get a maintenance medication, a drug that you have to take every day for the rest of your life to keep your blood pressure in check? Where are you
Yes.
getting the money
Mm.
pay for this prescription? So he could have been told at early as 20 and 22,
Yes.
But again, 15 more years go by, you're unmanaged with
Wow.
high blood pressure and
Jeez.
hypertension, and that takes a toll on your body.
Yeah.
So he has no health insurance, no prescription coverage. You go to the emergency room, you get treated and released to
Yeah.
go back to the same thing that you're doing, not managing high blood pressure and hypertension. And then 15 years later, here you are in a dialysis chair.
Yes. Now that touched me when you had told me that, and it bothered me a whole lot too. So we're trying to educate people and to find out help. That's why my show is also about resources. So I'm not just talking about your center or your brother's story, but the
Right.
resources out there. You know, to get insurance, because you got
Right.
cheap insurance and you got expensive insurance and you got somewhat free insurance. And
Right.
then insurance, some insurance stop at a certain age, like you said,
Yes.
like 18, 19, the child is grown, they got to get their own and they don't always have it. And then you have to
Right.
go to like a health clinic. Health clinics are free. And I found some other free clinics like $5,
Yeah.
$10.
Yeah. Yes. Yes. So
No,
even if they go to a health clinic again, they still get a prescription and they still have to
right.
make sure they get that prescription filled. So they have to have some type of insurance to help offset that cost. So if
Say
it's
that.
Medicaid,
Yeah.
if it's the state health insurance, if it's Medicaid, if you're low income, do that. If you
Yeah.
if you have some type of disability, then you can get Medicare through Social Security. You
Sure.
need to be able to take care of yourself.
Medicaid.
Our
Yes.
men, in our community, we don't go for annual physical exams. We
Say that.
have to go for that preventive care because
Right.
that will let you know a lot. If you have high blood pressure or if you're borderline for diabetes, but we have to get these things done. We have to take better care of ourselves. And I know
We
that
do.
sometimes it's a challenge when you don't have health insurance, when you don't
Yes.
have the money to go to the doctor and you can't go get an annual physical in the emergency room. So
Right.
I understand the challenges that a lot of people face, but we have to find some way, somehow, that they can get these annual exams and be able to participate in preventive care, not only
Yeah.
for their own health, but for their family.
That's right.
Nobody in your,
That's
your
right.
family doesn't want you to leave early, so you have to
No,
be
they
able to
don't.
take care of yourself.
Say that. Say that.
Yes.
Help Hope Live is one of the places that help you financially. And the Renal Network is another one that helps you financially. Sometimes they help the transplant person, the donor, or help with medications. They help you to fundraise for medications and stuff like that. And undocumented people, there's another free place that deal with things too. So, there's things out there. Sometimes you'd have to Google or ask one of the social workers or the nurses about it. And I know some stuff is just hidden under a rock. I never did so much
Yes.
digging and keep typing different things up trying to put the resources out there. But we all got to dig. It's all of our homework and it's all of our job because we all care. We
Yes.
all care,
Yes. Yes.
And if anybody wanted to build a dialysis center, what words would you say to them if they wanted to do
Um,
what you're doing?
well, I would tell you it's not easy. It's not easy. Fortunately for me, I do have 27 years in the insurance industry. My background is in insurance. So, coming from the health insurance side, so I used to work for a very large health insurance carrier.
Yes,
So I was very familiar with billing processes. That's how I found out that Medicare was the primary payer for a person on dialysis, and
yes.
that Medicaid pays for the office visits for the
Hmm.
person when they're going to see their nephrologist,
Come
their
on now, break it
cardiologist,
down. Yes,
their endocrinologist for whatever the diagnosis was that exacerbated and caused them to be go into renal failure. So my
yes.
background and it's you have to have some capital. I'm working in a public-private partnership with the city of Newark and Mayor Ras Baraka's administration to be able
Hmm.
to make this happen. But it's not an overnight. I've been working on this
I know
project
that's
for
right.
like almost 7 years to finally now see it to fruition. Where 7 years ago, I started just as an
Yeah.
idea, and
I watched you about
researching
four
it,
years
and
myself, 4 or 5 years, so I know it's long.
right,
Yes.
and then in the past 5 years really started to formulate a real plan, had to
Yes.
get other professionals involved to be able to get to this point, to
Mm.
be able to now get shovels in the ground. So, but it's you got to do your research. Um, Washington D.C. holds a lot of information, and when it comes to, because I had to get a market study done to determine if there was even a need to put a medical facility to provide the service. So it wasn't that I could just say, "Oh, let me put this facility in Newark." We had to do
Right.
right. I had to pay for a market study to be done to determine if a need
Wow.
actually existed. Would we
Yeah.
be was there really a need for the services we wanted to bring to the community? And all of these things
Yeah.
cost money. All that I'm paying is no risk. So you have to have some some equity and some capital to be able to
Capital.
consider
Hmm.
doing this. And it's not easy. Again, you have to work with the state to be able to get a facility of this nature built, the medical facility. But if you have a passion for it, if you have the capital to do it, and it's truly a
Yes.
need for the community that you're looking at, I would definitely say go with that passion and help the
Mm.
community if you have the ability to do so.
That's excellent. You said a
And
mouthful.
organizations that may be willing to assist, so maybe you can even partner.
Yes. Yeah, I remember Dr. David Scott. He had started a facility here, but he had worked in a facility that I was in. But he kept saying he was going to get his own, and it took a minute, like you said. It took a good long minute, but he built one, and it was really nice. It was really nice, and you could see he was
Yes.
trying. He really was
Yes.
trying, and he was really doing and everything. And it's not easy, and people be against you, and
Yes.
it's something else. All the stabs in the back, it's ugly, but he
Yes.
still did it against the odds. And so my hat off to him, my hat off to you as well.
Thank you.
My hat off to
Thank
you
you.
as well. Is there anybody you would like to give a shout out there, or anything you want to cover that I didn't ask or say?
You know what? I just have to say, well, one, thank you for allowing me to be on your show and have this platform to talk about my facility. To my brother Stephen Dunbar, so it's the Dunbar Center.
I ain't mad
So
at you. Come
because
on
he's
here.
gone through so much, and
Yes.
he still is a tremendous help to the community because he's a patient advocate himself, so he talks to so
Beautiful.
many people to educate them about this. And my project manager, Legacy Business Advisors, Tanisha Nash Laird, and Mayor Raz Baraka from the city of Newark and his administration to help me see this project through.
Wow.
And always to people like you, Lisa, who give me a platform that
Oh,
and have education and knowledge to be able to bring this issue to the forefront, to let people know in our community, in our urban communities, that this is a silent killer. This is a
yes, it
silent
is.
killer, and we have to
Preach.
have these discussions. So thank
Wow.
you.
Wow. Well, you welcome. I had Gordon on, and Gordon is who introduced me to you.
Thank you. Yes.
Yeah, yeah, Gordon
Yes.
Skinner. So
Networking
yeah,
happens.
yeah. See, look how that is. God put us together, and this won't be the
Yes.
last time. I'm positive. I know it.
Absolutely.
I'm sure it won't be the last time. Is there any website or anything you want put up, or need to put up, or say anything?
Well,
Oh,
I do. So the Dunbar Center does have a page on Facebook where we put out topical information every
beautiful.
week about chronic kidney disease and renal failure, and just information that's insightful about dealing with certain topics, and healthy recipes. So
Mm,
we do have a Facebook page, the Dunbar Center. I personally, Tammeisha Smith, have a Facebook page and on
yes.
Twitter. So please, any of those places, but we definitely would love you to like our Facebook page, the Dunbar Center.
Wow, wow. Now that's what I'm talking about. That's what I'm talking about. So, well, I definitely thank you too for coming on. I thank you for what you're doing, what you're already doing, what you're trying to do, and the success of it. The
Thank
success
you.
of
Thank
it.
you.
And you got to have to come back with the success of it, and,
Yes.
keep it going out there. I'm glad for what you're doing, and I appreciate you very much. I
Thank you.
appreciate
Thank
you
you.
very much. Share this. with your friends and family. The awareness is the key. So, this network, this show, and we'll definitely share your stuff too. I don't mind. Any
Yes.
resources you need for that, or anything you need me to help you with, call me. I'll come out there to Jersey. I ain't
Thank you.
scared, so, you know, you my girl. So, hey, anything you need, just let me know, and you be
Thank,
well and you be blessed. And I thank
thank,
you again. I appreciate you.
thank you so
Okay.
much. Thank you.
You're very welcome. You're very welcome. And I thank everybody else for tuning in tonight. I thank you for showing up. I thank you for listening. I thank you for learning. I thank you for writing stuff down. And I thank you just for supporting this network and the Lisa Baxter Show. We love you. We pray for you. And we got your back. All right. Giving you that 411. Good night. Be well and be blessed. And thank you once again. Lisa Baxter. Peace. Bye.